Welcome back to the CTV News. And now, as part of our public service, we air excerpts of a presentation made by oncologist Dr. Owen Gabriel to an audience in Mon Repos. It was part of an initiative to draw attention to an increase in the number of cases of cancer coming from that community. In tomorrow's newscast, we will get details from the organizer of the event. But tonight, we feature excerpts of a presentation made by oncologist Dr. Owen Gabriel. Here is part one of that presentation.
Even the chemicals we use to control weeds or weedicides might have cancer-causing substances. Some of the chemicals we use to control pathogens like yellow sigatoka and so on might contain carcinogens. So we're very much exposed to some of these chemicals. And our farmers and other workers in other fields might be exposed, and that's why we see cancer in all of our communities where we have people working. Now, age. As you get older, there seems to be a more likelihood that you might develop a cancer. And this is probably due to the accumulation of damaged cells in your body over time. And also the body's defense mechanisms against abnormal cells become less viable as you become older. For example, the ability to repair damaged cells and the immune system, which may destroy abnormal cells, may become less efficient with age. So eventually, one damaged cell may manage to survive and multiply out of control into a cancer. And most cancers develop in older people. Now we will see that a long time ago, cancer was directly and strictly associated with older people. And now we see that there's a trend towards younger people developing cancer. And we'll see how that works out when we talk about certain types of cancers down the line, like breast cancer. There are a number of lifestyle factors that we must consider as well. Diet. We have spoken about in a lot of cases. If you eat a lot of fruit and vegetables, you have reduced the risk of developing certain cancers. But we know cancers are more prominent and more prevalent in persons who eat a high-fat diet, a diet low in fiber, and a diet that is high in a number of preservatives that we use commonly these days. So one wonders, when we have all our kids developing certain types of cancers along the way, whether these genetic mutations that are really associated with some of these cancers, leukemias and so on, whether it's because maybe through in the uterus, while the lady is pregnant, some of these chemicals may be coming in through the placenta and causing some of these changes during the development of that child, during the fetal development and so on. The exact way in which we know that fruits and vegetables protect against cancer is not fully understood. These foods are rich in vitamins and minerals and also contain chemicals called antioxidants that you've heard a lot of before. They may protect against damaging chemicals that get into our body. We should all eat at least 5 portions of fruits and vegetables a day. And some researchers suggest that we may need to eat up to 9 and sometimes 13. These days we're trying to compete whether fruits are more important than vegetables. But I suggest to you that they are both very important in our diets. Eating too much fatty food probably increases the risk of developing certain cancers. And we know that fatty food high in red meats, for instance, beef and so on, we know there's a correlation with certain colon cancers that we have in our society. Certainly, overeating will lead to overweight and obesity. And lack of regular exercise are all factors that come together where it concerns a proper diet with cancer. And we see those factors very prevalent in chronic illnesses that we talk of: hypertension, diabetes, stroke, kidney failure. All of these things that we talk about that are very prevalent in our community and our society are also associated with cancers. And also, another factor in our lifestyle would be drinking a lot of alcohol. So we suggest a moderate consumption of alcohol if you want to do that. But obviously, refraining from the consumption of alcohol and obviously refraining from smoking completely will reduce your risk of developing cancers.
You're watching the CTV News. We will hear a bit more from Dr. Gabriel in a short while. Stay tuned. Welcome back to the CTV News and our special broadcast tonight focusing on cancer and its impact on local communities. We are featuring a presentation made by oncologist Dr. Owen Gabriel. Here is a continuation of that presentation.
We think lifestyle accounts for almost half. Well, all of these factors, smoking, alcohol, lack of exercise, obesity, a diet high in fat, all account for almost half, 45% of our cancers could be related to lifestyle. And it is where we can make the most important change for us to reduce our risk. There's also the carcinogen of radiation. For example, exposure to radioactive materials and nuclear fallout can increase the risk of developing cancers like leukemias. Too much sun exposure, ultraviolet A and ultraviolet B rays, have increased the risk of developing skin cancers. And we know this because of the bombs in Nagasaki and in Hiroshima that resulted in cancers in those people who were exposed to some of these radiations that were studied in that time. We also know that infection is a cause of cancer. Some viruses are linked to certain cancers. For example, people with persistent infection with hepatitis B virus, which we know is common among our people as well, hepatitis C virus, have an increased risk of developing cancers of the liver. Another example is the link between HPV. You know what HPV is? HPV stands for human papilloma virus. So human papilloma virus is sexually transmitted, and it is the cause in most cases, over 90% of cases with cervical cancer, you can associate and you can find the HPV effects on those cells. So most possibly, and probably, most possibly all women who develop cervical cancer have been infected with certain strains of HPV. So HPV can cause other types of genital symptoms, but some subtypes of HPV will cause cervical cancer. However, most viruses and viral infections are not linked to cancer. And it remains to be seen as we uncover these new viruses that we have been finding emerging and re-emerging over the years. You know, we had H1N1 and other viruses that have been coming along, whether these things eventually will be associated with cancer. I'd like to talk about our immune system. People with poor immune systems have an increased risk of developing certain cancers. For example, people with AIDS, HIV-associated AIDS, or people with a poor immune system who take immunosuppressive therapy. These people have an increased risk because your immune system is probably your first defense of fighting off abnormal cells or cancerous cells in your system. Some cancers have a strong genetic link. For example, in certain childhood cancers, the abnormal gene or genes that may trigger a cell to become abnormal or cancerous are inherited. Other types of cancers may have some genetic factor which is less clear-cut. It may be that in some people, their genetic makeup means that they are less resistant to the effect of carcinogens or other factors such as diet. However, having mentioned all of these things, it is possible that most cancers are probably due to the combination of factors, not just one factor. Not everybody who comes in contact with a carcinogen or has an unhealthy lifestyle will develop cancer. Sometimes the gentleman used this to tell me, well, boss man, je vais fumer marijuana puisque il va faire moyen. But sometimes you may have a genetic makeup that will not lead to cancer. Not all smokers develop lung cancer, for instance. In fact, we are all probably exposed to low doses of carcinogens a lot of the time. The body has certain mechanisms that may protect us from developing cancer. For example, it is thought that many cells are damaged by carcinogens can repair themselves, and we are aware that there are repair genes in our cells. Also, the body's immune system may be able to destroy some types of abnormal cells before they multiply into a tumor. Perhaps one carcinogen may only damage one gene, or two or more genes may be needed to be damaged for that cell to develop into a cancer. In many cases, it is likely that a combination of factors, such as genetic makeup, exposure to carcinogen, age, diet, the state of your immune system, etc., will all play a major role in either preventing the development of cancer or eliminating it completely.
This is the CTV News. When we return, we will feature the final excerpt from oncologist Dr. Owen Gabriel. You're watching the CTV News, and tonight we are talking about cancer. The presenter is Dr. Owen Gabriel. He addressed a community event in Mon Repos, drawing attention to cancer and what you ought to know about the disease. Here is the final installment of that presentation.
I can count the men sitting here in this audience on one hand, not so? So the majority of the crowd are women. And this is part of the problem why men die more of cancer and of other illnesses, especially chronic illnesses, because men tend to be less attentive, less willing to take the next step into their health issues. And most men are afraid of the digital rectal exam, which is a key procedure and intervention for the doctor in diagnosing your prostate cancer. And I said to men, if they knew what doctors have to do to diagnose women when they do their pap smears and so on, where we use more than just a finger for the women, they would not complain. But most men are either afraid or they suggest that c'est méchant state docteur a fait moins. But we want you to go back to your husbands and your brothers and your siblings and your boyfriends and so on and tell them that they must see the doctor. And there's a certain age we suggest that you want to start getting in tune with your doctor and your prostate as of age 40, start having these questions being asked and verifying your risk factors for prostate cancer. So the digital rectal exam is an exam where the doctor introduces his finger through the rectum and he feels the prostate for lumps or changes or hardness and changes in consistency or abnormal areas. You also heard the PSA, prostate-specific antigen, which is a blood test that we use that can tell us that there's some issue with the prostate, whether it is inflammation or infection or BPH, benign prostatic hyperplasia. It does not diagnose cancer. So the diagnosis of prostate cancer is something that looks at a number of factors, including your biopsy, where some cells are removed from the prostate, sent to the lab, and the pathologist will have a look at those cells and will tell us and confirm to us the question of whether it is prostate cancer or not. Once we've done that, the patient goes through staging, where we do other tests, x-rays, ultrasounds, sometimes MRIs are necessary to be able to stage that person. And once we stage that person, we are able to decide what kind of treatment we have according to that stage. The treatment are about 7 different ones. Watchful waiting or active surveillance is one of the first treatments that we use. It's a common treatment for older men who do not have signs or symptoms of prostate cancer, but have other medical conditions. I have to say to you that the majority of men who have prostate cancer do not die of it. So it is possible for a man to have prostate cancer and he will live the rest of his life and probably die of something else like a heart attack or a stroke, and not the prostate cancer. So a lot of prostate cancers can be observed and monitored by your doctor. And that's basically what we say with watchful waiting and active surveillance. Once that person develops symptoms, the doctor seeks to alleviate those symptoms through other means. Surgery is the most common other procedure that we use. And we've heard of a radical prostatectomy. And sometimes we want to extract the lymph nodes associated with that. Currently, in the world, this is done through robotic surgery, so that you have something called nerve-sparing surgery, where the man usually and previously, when men had surgery for prostate cancer and other prostate diseases, he would lose his ability to have an erection. And now we are able to preserve the erection of the man, and through techniques that have been developed over time. Otherwise, we can also have radiation, where radioactive rays are applied to the prostate to kill some of those cells. You can have hormone therapy, whether it's injectable or tablets that the man can take. Chemotherapy, in the case where a prostate cancer becomes hormone resistant and there are no other interventions that can be used. Chemotherapy is a viable intervention. There's some biologic therapy that we use. There's immune therapy currently around the world that seems to be taking on good success trends overall. And there are a number of drugs that we use to help the other symptoms of bone disease, bone pain, and so on that we use. I'd like to say with all of these treatments that we've spoken about, I think in St. Lucia, our area should be to look at interventions that are not strictly medical. So psychological treatment and social support are central to cancer care. And I think it's one of the interventions that Faces of Cancer attempts to do by giving support to our cancer patients. There is now abundant evidence that psychosocial factors underlie a person's susceptibility to and recovery from this illness called cancer. If we ignore these factors and we pour millions of dollars into the latest technologies, it's almost like spending lots of money to buy a very expensive sports car, and when we have it, we have no gas to put in it.
As we said earlier, tomorrow night we will talk to the organizer of the Cancer Awareness event in Mon Repos, Marilyn Gaston. Her fascinating story in tomorrow night's newscast. Incidentally, Marilyn is organizing the third discourse on cancer. It will be held later this year. Join us tomorrow for a special on that last event organized by Ms. Gaston. And that is how we conclude our newscast tonight. I am Natalie Fannis. Good night.